So the list is really long, which I could tell you what things you should consider before planning to shift to US. Number one thing, if you are a doctor or even an engineer who is thinking about long term, see for me, like spending almost like 3 decades of my life in India, it was really overwhelming decision for me whether I'll be able to adjust to this lifestyle or not. My whole family and friends are back home, so what are the things that are really important for me to move to US? Of course, money just plays one part of your life, but then your quality of life, as in your social life, etc., plays a big role. So you have to put each and everything into consideration before even planning to shift to US, right? So number one thing is that you should do, which I did, was like an experimental living. I know it can be hard and on your finances, but this is one chance that I took, and I literally asked my parents that whatever money that you were planning for my marriage, I would please request you to invest that money for me so that I can at least live for some time in US, obviously with some kind of clinical rotation, so that I can get that experience. How is life in US, and how is the lifestyle in US, how are people, how is the weather, and whether I'm able to sustain my life alone, living in a place where I have to cook myself, clean after me, and everything, which we don't realize in India, but we are so spoiled. You have to do each and everything on your own, which is not a big thing, but then this is something which is not a big thing, but it is something that Indians are usually not used to, because since childhood हमको feed किया जाता है, and then we are so spoiled कि I don't know about you, कि when you are sitting and studying, आपकी mom आपको खाना ला करके देती है and things like that, right? There is a maid for everything, and we are lucky and blessed in that sense, but it should definitely come from the point what your long term, like 5 to 10 year goals are, and are you willing to spend these years working on your growth, and do you want to learn more? Staying is in comfort is good and all, but do you want to grow? Okay, so that I cannot answer for you. That you have to look at your life individually, whether living in India or in your hospital or surrounding is something that will help you grow faster, or going in some other country, doing fellowships or doing rotations, taking some experience will just hike your growth like anything. So as soon as I realized, I was in third year of PG, I realized that I was working way too hard than what I was being paid, than what I was being treated as. Like the life of doctors is not very safe, and then the toxicity, politics, and the ladder of growth is just doesn't seem fair. Okay, definitely nobody has to agree with me on anything, but that was my individual experience. And then the passion and the little girl's dream that was always there inside me, that I had to go to US and to just experience and just to see the world, always stayed there. So that the first time when I came, in 2022 December, was the time when I actually saw this big world. And definitely, even if you're not planning to settle anywhere abroad, you should at least come at least once to experience this kind of life, not just as a tourist, but as a clinician, as an observer. When you see the hospitals, the big machines that you always used to read about in books, when I went to Cleveland Clinic for rotation, it was so overwhelming, and it felt like life made more sense. As a radiation oncologist, I was in awe of the life that I could have been living, and there was no right time for this. That time was the perfect time, because trust me, in India sometimes it becomes too frustrating with the little bit of options you have as a radiation oncologist. But when you come here, you see yourself as a part of this huge circle and huge life, where you actually feel like that you're doing something meaningful, and you can be part of, you know, big researches, and you get to work with the doctors who literally invented, you know, SRS, like one technique of radiotherapy. So I got the chance to work with such kind of people, and for me as a clinician it was like a dream come true. And seeing the work life balance, seeing people respected each other in professional setup, and nobody, you know, using mean words, not playing politics, and just are very professional. And there is a very distinct you know, professional time and leisure time. Weekends are taken very seriously here. I mean, you're not supposed to work on weekends, and people do make frequent trips and travel and hike, and you know, take care of their own health. They work on their own, they cook. So I mean, even if you're not doing anything or not planning to settle anywhere, this kind of experience in just an year, I have grown as a person. I mean, I couldn't have in many years. Living alone, talking to strangers, talking to different culture people, has opened so many doors of experience to me that I could never imagine that I would be so comfortably and so confidently talking to people. And even I feel like a New Yorker that I'm helping people around, finding their ways around the city. So it feels like you have become such a mature person. So as a person, it was at the same time challenging in the beginning, and even now I'm trying to find my way. But at the same time, you should know your true reason, and that if that's just for money, then I'm sorry to say you might be disappointed after a few years. But you have, if you have a big goal, if you like traveling to new places, if you like talking to people, then you are in for a treat. You know, going out to different cafes, enjoying different sets of weather. The weather of US, and especially where I am in New York, is completely different. It is it rains, it snows, and it is so windy, and it is so chilly even right now. So yeah, like you have to see each and everything before even deciding to settle for so many years and putting in so much of hard work. So just after my USMLE step 1, I decided that first I need to live this life at least for 6 months to even make that decision. And even starting this research job as a postdoc research fellow was a kind of experiment for me, because you can imagine if you are planning to settle as you know, as a resident, and you want to do residency, you put in so much of hard work, and then you don't even know. I know so many people who have come back to India because they just didn't like the life here. So what kind of city that you're living in, what kind of hospital that you're working in, do you know people around you, do you have many Indians around you? These factors change a lot of scenario. Is the weather too harsh for you? I mean, these are the things that you should consider before you even plan to settle in for a residency. But before that, definitely do this experimental stay in US, which definitely will require money, dude. But at the same time, you have to make that decision for the whole life, right? So yeah, come here, take the experience, and do let me know in the comments. I can do such type of interaction many more, but when we are talking more regarding one particular topic, so I need to prepare for the video. But yeah, I will be happy to make more videos like this. So till the next time, see you guys, and take care, and be confident in yourself. Life in India was good, life in US is good. It's just you have to decide is which good do you want to work in, right? So see you.